We're just days away from the completion of Phase 1 of a 59,000 square foot emergency department expansion at the Adena Health System's main regional medical center campus in Chillicothe. There's 3 times more space with more patient rooms and care areas, allowing for faster access to care. The official ribbon-cutting ceremony is Friday, July 27th, and a community-wide celebration is planned for Saturday, July 28th from 11 a.m. to 2 p.m. Phase 2 of the expansion and renovation project will concentrate on the hospital's west entrance area, set to begin immediately following Phase 1, and is expected to be complete by December 2019. Adena's CEO Jeff Graham, Vice President Nick Alexander, and Director of Emergency Services Robin Berno give us a guided tour.
We are now in our CDU of our new emergency department. The CDU stands for Clinical Decision Unit. This will be a regular ED in Phase 1. Phase 2, it'll actually be a unit that will be a longer stay. So those patients who are coming in that might have chest pain and need additional testing, instead of going to the floor, they'll stay here. They'll get all their care, they'll be discharged from here, and it'll be a lot better for them so that they don't kind of get lost whenever they get upstairs.
And compared to our process today, that patient would be transferred upstairs?
Might be here 24, 36 hours.
So it's going to be more convenient for the family.
So hopefully they'll be here 1/3 of the time.
Yeah.
Good. That's the plan.
Just take a...
So this unit has 10 beds, and again, it is part of the regular emergency department. We have nurses stations back here. The rooms are lovely. We put a lot of work into doing our head walls so that it wasn't just a typical emergency department room. We chose 8 different themes, and we tried to pick things that were kind of like Ross County. So you'll see some pretty interesting pictures in some of these. We think that will be very appealing for our customers and our patients as they come through. As you can hear, we've got a little bit of construction still going on in the background. So this hallway from one end to the other, I think it's about 100 feet. So this is going to be something that's going to be real interesting for our patients and for our staff as they are taking care of the patients that are coming into the new ED. So what we're entering into now is going to be the main part of the emergency department that is considered our 24/7 area. So these beds will be open 24 hours a day. And the way the emergency department works, as patients come in throughout the day, there's times during the day that the volume's a lot higher. So we don't always need to have all the rooms open all the time. But this space that you're looking at is going to be open 24 hours. And we're going from having about 16 beds open, 15, 16 beds open 24 hours to 20 beds that will be open 24 hours. So that'll make a big difference. One of the rooms that we added for our families is a family room. And we're going to kind of walk through here. This is an actual patient room. But this room is a place where our families can stay while their loved one is being cared for, especially if you're in a critical situation where they need to have some privacy and some quiet time. Maybe a place where they can get a hold of other family members that need to come in. Clergy can come in here and be with the families. And this is a really nice addition to our new ED.
Adena was founded back in 1893 by the ladies of the area churches, and our board representation today is still, those churches. And so this room is being sponsored by the 9 corporate churches here in our community. So, and they will be recognized outside, and you'll be able to see all the churches, and the recognition will be listed there of who they are in our community, and very, very much in support of all that we're doing here at Adena and responsible in helping us be who we are today.
This will make it nice too because there's entry into this room from the family room, so that kind of provides a little bit more privacy for the families as well. So that way they can kind of come in and out of this room and not have to be out in the hallway. Something that our community is really going to notice that's going to be different is our nurses' stations. Currently, our nurses' station is about as big as this space. Now, actually, this space is even bigger.
Bigger, yeah.
So, when we get in here, it is going to be so nice that our staff, our providers, we have a lot of residents, med students, student nurses, that we're actually going to have some great space for them as they learn and as we take care of our patients.
And I would also add to that, too, with the way the design is, the nurses' station is situated in between the rooms. So you literally can walk 10 feet from the nurses' station into the rooms, which is very nice. In our current, we don't have that.
No, we don't.
So,
and another great thing that we hear often from our patients is the curtains in the rooms in our old ED. So as you can see, we've got private rooms with glass doors that will close. It'll be quiet, it'll be private, and this is going to be a huge change for our community as they come in. These two rooms are very exciting for us. These are our trauma bays. So currently our trauma room is about maybe half this size. We have 2 trauma bays. We have a sliding glass door that goes between the 2 trauma bays. Behind the trauma rooms is a great storage area where we have all of our critical equipment that we would need for a patient who came in as a trauma. And this is just going to be so much nicer than what we have had in the past. We can get a team of people in here that we can provide care very quickly whenever patients are coming in as a trauma.
I think going back to our earlier comment, if you notice, if you scan from here all the way down the center, right, you can see the access that the staff will have throughout the entire department, being able to have access back to the patients. So the workstations, if you will, for nursing and the providers is right here in the center or the core of the emergency department. And then the visibility that you have to all the rooms.
That was one of the points I was going to bring. What Jeff is saying is visibility to every room. So from a nurse's station, you can see into every exam room that we have at Adena, where anything that's happening with the patient will be eyes on sight.
This is our new EMS entrance. This is going to really be a lot nicer for EMS because the bays are much wider. Currently, I think we can get 2 squads through there, and I think the way that we have designed this, we can get 4. And then we'll have nice parking out there for them as they unload the patients and they come in to do their paperwork. We have a really nice room. I'm not sure if we can get to it. We've got a really nice room for our EMS so that they can prepare their reports, and there will also be a place for them to have refreshments while they're coming in to finish things up. These 2 rooms will be what we call hall beds, but actually they are a very nice room where we can go ahead and start the care on the patients if we have, in the event that we would be completely full and they would need to have a place where we can start care. Oh yeah. Another thing, Dan, that is new for this, for our EMS, there will be a board whenever EMS comes in the door, and I believe it's going to be close to this area. So if Chillicothe's coming in, they'll know exactly what room their patient's going to go to. It'll be listed up there for them, and that's going to be a great tool for them because currently they have to come in and they have to wait for the charge nurse to let them know where they're going. And this is going to be a great addition for the new ED. Let's go back here and see. This room may be available for us to kind of take a look at. This is another addition that actually came from our EMS request. They wanted a room where they could get their boards washed whenever they bring somebody in on a backboard. So this room has been designed so that they can do their board wash in here, and then we can stack those up and have those lined up for them for whenever they come back in. And this room is the EMS and Police Room, and by police we mean like OSP, Ross County. This is where they can do their reports. We'll have mailboxes for the individual townships, so if there's something that we need to distribute to them, they will have mailboxes. And again, there'll be a little conference table over here for them. We'll have hookup for them for their computers, and we'll have a printer and everything in here for them. So it's going to be a really, really nice space for them, which is going to be, that should be a great crowd pleaser for them, because they've asked for this for a long time, so we're real excited that we're able to bring that to them in this. We'll go out and hit the lobby.
All the way down there is going to be for employees.
Dan, another couple of additions that we have with this build is our decontam rooms. So these two rooms behind you, these are rooms if we had a patient that would come in and they would have chemicals all over them. There is a door from the outside. We can look through here and see. There's a door from the outside so the patient could actually arrive through that door. There's a shower over there, and we can decontaminate them, and then their patient room is right there, so it's a very easy flow. Now, our lobby obviously is still under construction, and there's a lot of them out here who are constructing. Over there to the north is the walk-in entrance, and then the patients will come through there. We'll have a metal detector, and they'll walk through the metal detector, and then that desk where that gentleman in the gray t-shirt standing, that will be the reception desk where they'll be greeted.
You won't tell nobody,
This is the wheelchair.
Yep, wheelchair, entrance will go to the left.
Yeah.
Over here is the metal detector.
So our security will be sitting up there too whenever they come in. Security will be there. And then they'll be greeted here. And then once they are triaged by the person who is out here, then the determination will be made, can they go back to a fast track area where our less acute patients are, or do they need to go back to a regular bed? The triage nurse will sit back in that corner, and then he or she will see patients in these 4 areas. And this area is open 12 hours a day during our busiest times from 11 to 11. We're so excited about these nurses' stations. We can't even begin to tell you how exciting this is.
Have they seen them yet?
Yes, many of them have been over. We come over and bring them as often as we can because we want them to understand this footprint, how much bigger this footprint is for them to be covered. So this nurses station here is the main nurses station. So the charge nurse will be there. As EMS comes in, they're going to be in charge of everything that happens in this department. Something that won't be available until the project is complete will be our behavioral health rooms. And these rooms are used for patients who just need to be watched very closely. Perhaps they're suicidal, homicidal, something like that. And we'll have 4 of those rooms once the project is complete. And the nice thing about that space is the room is very safe for them. And currently in the old emergency department, they're sitting in a room that's got a curtain and they're out in the open. This will provide privacy to the patients, and number one, obviously, is the safety that we provide to them. Throughout the department, we've got some internal waiting rooms. And I think that this is really going to be something important for our community to understand. So if you come in and you're in a patient room and you're ready to be discharged, maybe you're just waiting for a prescription or you're waiting for your discharge papers, we can move those patients out and put them into an internal waiting room. and then we can get that room turned over and bring another patient in out of the lobby. That's how we're going to improve our efficiencies and our throughput in the emergency department, by getting those rooms emptied up, getting the patients where they need to be quickly so that they can be seen by a provider. Because our manager, Neely Kinnison, she says, our patients don't come to see a nurse, they come to see a provider. So we want to get them in as quickly as we can to see one.
On our first floor, this is kind of an area dedicated to our caregivers and our providers. In this area, we have our staff break room, but one of the things we're proud of is our graduate medical education program and our residents and medical students that came to Adena to learn and to be taught from our providers. So in these areas, as we walk down the hallway, we have a graduate medical education library. We have offices for both the students and the teachers. We have 2 conference rooms that are going to come on that are smart conference rooms that have connectivity not only to the rest of the hospital but between each other, so we can have large teaching seminars that are going across both of these conference rooms I'll show you. As we walk through Adena, we pride ourselves on safety of the patients and our caregivers and really the community. One thing we kind of lacked over the years is our disaster planning from an incident command. When we do have something in the community, where does that take place? And these rooms that we have double up for that service, so we can provide incident command and really a community service. So this would be the second conference room that would be able to teach, our caregivers and our residents and medical students. Locker room, shower, and changing area.
It's 5 times bigger than the other one.
At least.
5 times bigger.
Yeah. So there'll be lockers all around the wall, and then there'll be benches that will go north and south and east and west, so that the staff will be able to sit down and change their shoes, and in the winter time take their boots off and put their tennis shoes on. This is such a big deal for us because we don't have this space currently. This is a really big deal.
The official ribbon cutting ceremony is Friday, July 27th, and a community-wide celebration is planned for Saturday, July 28th from 11 a.m. to 2 p.m. This will mark the end of Phase 1, and Phase 2 work begins soon, with completion by December of 2019. I'm Dan Ramey. Thanks for watching Litter Media.